Welcome to Book Buzz Reviews and Summaries. Pregnancy is one of life's most transformative journeys, a time filled with anticipation, joy, and yes, a fair share of uncertainty. As you step into this incredible experience, you might find yourself bombarded with a whirlwind of information, advice, and questions that can make your head spin. What exactly is happening to your body? How is your baby growing and developing inside you? What should you be eating, avoiding, or doing to ensure the healthiest pregnancy possible? In a world where everyone has an opinion, wouldn't it be comforting to have a trusted, authoritative guide that walks you through each step, providing clear, evidence-based answers to all your concerns? Enter Your Pregnancy and Childbirth, Month to Month, by the American College of Obstetricians and Gynecologists, ACOG, a comprehensive guide that has become the gold standard for expectant mothers. Unlike other books that may lean heavily on anecdotal advice or popular trends, this guide is grounded in the latest scientific research and expert recommendations. It's not just about telling you what to do, it's about empowering you with knowledge so that you can make informed decisions every step of the way. From the moment you see those 2 lines on a pregnancy test, your life changes forever. This book acknowledges the weight of that moment and carries you through the subsequent 9 months with a month-by-month breakdown of what to expect, what to prepare for, and how to handle the myriad of emotions and physical changes that will come your way. Each chapter delves into the specifics of fetal development, explaining in detail what's happening inside your womb. You'll learn about the milestones your baby is reaching, the growth spurts, the development of vital organs, and even when your baby's heartbeat starts to echo within you. But your pregnancy and childbirth isn't just about the baby, it's about you, too. This guide is sensitive to the fact that pregnancy affects every part of your life. It addresses common symptoms like morning sickness, fatigue, and heartburn, offering practical solutions and medical advice. It also explores the emotional roller coaster that comes with pregnancy, from the joy of feeling that first kick to the anxieties that can sometimes overshadow the excitement. Mental health is a significant focus, with tips on how to manage stress, stay connected with your partner, and maintain a positive outlook throughout the pregnancy. Moreover, this book tackles the critical topics that every expectant mother needs to know: nutrition, exercise, prenatal care, and the importance of regular medical checkups. It gives you the tools to advocate for yourself in medical settings, understand the importance of various tests and screenings, and prepare for labor and delivery with confidence. And when it's time to bring your baby into the world, the guide provides a detailed look at what to expect during childbirth, whether you're planning for a natural birth, considering pain management options, or facing the possibility of a C-section. What sets your pregnancy and childbirth apart is its authoritative voice, crafted by experts who have dedicated their lives to women's health. It's like having a team of top-tier obstetricians by your side, ready to answer your every question, ease your fears, and celebrate the miraculous journey you're on. Whether you're a first-time mom or expecting your 2nd or 3rd child, this book is an indispensable resource that will help you navigate the complexities of pregnancy with grace and confidence. It's not just a book, it's a trusted companion for every step of your pregnancy. Introduction: A comprehensive guide to pregnancy. Pregnancy is a transformative experience, filled with excitement, anticipation, and many questions. For expectant mothers, having a reliable, well-informed guide to navigate these 9 months is invaluable. Your Pregnancy and Childbirth, Month to Month, authored by the American College of Obstetricians and Gynecologists, ACOG, stands out as one of the most comprehensive resources available. This book is not just a guide, it's a trusted companion for the entire pregnancy journey, providing evidence-based information, practical advice, and emotional support from conception to postpartum. In this review, we will explore how this book serves as an essential tool for expectant mothers, covering its month-by-month structure, the range of topics discussed, and how it addresses both common and complex pregnancy issues. We'll also consider how the book balances medical information with the personal aspects of pregnancy, making it accessible and reassuring for readers at all stages of their pregnancy. Chapter 1: The Foundation, Understanding Pregnancy. The first chapter of the book lays the groundwork for the entire pregnancy journey. ACOG starts by explaining the basics of conception, the early signs of pregnancy, and what to expect in the first few weeks. The tone is both professional and compassionate, recognizing that the early stages of pregnancy can be both thrilling and anxiety-inducing. The book provides a detailed explanation of what happens during fertilization and implantation, helping readers understand the biological processes that are taking place. This section is rich with diagrams and illustrations that make complex concepts easier to grasp. For many women, understanding these early stages helps to demystify the pregnancy process, making it feel more real and tangible. ACOG also addresses the emotional aspects of early pregnancy, acknowledging the wide range of feelings that women may experience, from joy and excitement to fear and uncertainty. This balanced approach is one of the book's strengths, as it validates the reader's emotions while providing the factual information they need to move forward confidently. Chapter 2, Month-by-Month Journey, a deep dive into each street. The core of the book is its month-by-month breakdown of pregnancy. Each chapter focuses on a specific month, detailing the physical and emotional changes that expectant mothers can expect, as well as the development of the baby. This structure is particularly effective because it allows readers to progress through the book in tandem with their pregnancy, making the information timely and relevant. Month 1, the start of a new life. The first month is all about understanding the very beginnings of pregnancy. ACOG describes the early signs and symptoms, such as missed periods, morning sickness, and fatigue. The book also offers guidance on when to take a pregnancy test and what to do once you confirm that you're pregnant. What stands out in this chapter is the emphasis on early prenatal care. ACOG stresses the importance of seeing a healthcare provider as soon as possible to begin prenatal vitamins, assess any potential health risks, and establish a plan for the pregnancy. The book's clear, step-by-step advice makes it easy for readers to know exactly what actions to take during this critical time. Month 2, the formation of essential organs. By the second month, the embryo is developing rapidly, and many of the major organs begin to form. ACOG provides detailed descriptions of this development, helping mothers visualize what is happening inside their bodies. The book also addresses common symptoms during this time, such as nausea, food aversions, and changes in mood. ACOG's approach is very reassuring. It normalizes these experiences while providing tips on how to manage discomfort. The book also encourages readers to start thinking about lifestyle changes, such as diet and exercise, that can support a healthy pregnancy. This chapter is a perfect blend of medical information and practical advice. Month 3, the end of the first trimester. The third month marks the end of the first trimester, a significant milestone in any pregnancy. ACOG explains the developments that occur during this time, including the formation of the baby's limbs and facial features. The book also discusses the reduction in miscarriage risk and what that means for the expectant mother's peace of mind. What's particularly useful in this chapter is the advice on preparing for the second trimester. ACOG offers guidance on choosing a healthcare provider, planning for prenatal testing, and starting to think about childbirth options. This forward-looking approach helps readers feel prepared and in control as they move into the next phase of their pregnancy. Chapter 3, Navigating the Second Trimester, the Honeymoon Phase of Pregnancy. The second trimester is often referred to as the honeymoon phase of pregnancy, and ACOG's treatment of this period reflects that. This section of the book is full of positive, encouraging messages, acknowledging that many women feel their best during these months. Month 4, the baby begins to move. In the fourth month, many women start to feel their baby move for the first time, an experience that ACOG describes with both scientific detail and emotional sensitivity. The book explains how these movements are a sign of the baby's growth and strength, offering reassurance to mothers who may be anxious about their baby's development. ACOG also addresses the changes in the mother's body, such as the expanding uterus and the onset of more noticeable weight gain. The book's focus on self-care during this time is particularly valuable, with tips on managing back pain, staying active, and eating well to support both the mother and baby. Month 5, the anatomy scan. Month 5 is highlighted by the anatomy scan, a major event in any pregnancy. ACOG provides a thorough explanation of what this scan entails, what it looks for, and what parents can expect during the procedure. The book also discusses the emotional aspects of this scan, as it's often the time when parents learn the sex of their baby and get a detailed look at their child's development. The book's treatment of this topic is comprehensive, yet sensitive, recognizing that while this scan can bring joy, it can also be a time of anxiety if any issues are detected. ACOG offers advice on how to prepare for the scan, what questions to ask, and how to process the results. Month 6, preparing for the third trimester. As the second trimester comes to a close, ACOG shifts the focus to preparing for the third trimester. This chapter covers a wide range of topics, from the importance of continuing prenatal care to starting childbirth education classes. The book also begins to introduce the concept of a birth plan, encouraging mothers to think about their preferences for labor and delivery. One of the standout features of this chapter is the emphasis on mental health. ACOG discusses the importance of staying connected with your partner, managing stress, and seeking support if you're feeling overwhelmed. This holistic approach ensures that readers are not just physically prepared for the final stages of pregnancy, but emotionally ready as well. Chapter 4, The Final Stretch, Third Trimester and Preparing for Birth. The third trimester is both exciting and challenging, as the baby's birth draws near. ACOG's coverage of these final months is thorough, offering practical advice on everything from managing physical discomfort to making final preparations for the baby's arrival. Month 7, the baby's rapid growth. In the 7th month, the baby is rapidly gaining weight and preparing for life outside the womb. ACOG provides detailed information on fetal development, helping mothers understand what their baby is experiencing during these final weeks. The book also discusses the common physical challenges of the third trimester, such as swelling, shortness of breath, and difficulty sleeping. In the 7th month, the baby is rapidly gaining weight and preparing for life outside the womb. ACOG provides detailed information on fetal development, helping mothers understand what their baby is experiencing during these final weeks. The book also discusses the common physical challenges of the third trimester, such as swelling, shortness of breath, and difficulty sleeping. ACOG's advice is practical and supportive, offering tips on how to stay comfortable and healthy as the pregnancy progresses. The book also encourages mothers to start thinking about their postpartum plan, including breastfeeding, postpartum care, and how to manage the transition to parenthood. Month 8, the final preparations. As the due date approaches, ACOG shifts focus to the final preparations for birth. This chapter is packed with practical advice on what to pack for the hospital, how to recognize the signs of labor, and what to expect during delivery. The book also discusses the different types of labor and delivery options, including natural birth, epidurals, and cesarean sections. One of the strengths of this chapter is the emphasis on informed decision-making. ACOG encourages mothers to discuss their birth plan with their healthcare provider, ask questions, and make choices that feel right for them. This empowering approach helps readers feel confident and prepared for the birth experience. Month 9, the birth of your baby. The final month of pregnancy is filled with anticipation and excitement. ACOG covers the final stages of fetal development, the signs that labor is approaching, and what to expect during delivery. The book provides detailed information on the stages of labor, pain management options, and the role of the birth partner. This chapter also addresses the immediate postpartum period, including what to expect in the first few hours after birth, how to initiate breastfeeding, and the importance of skin-to-skin contact with the baby. ACOG's advice is practical, evidence-based, and designed to help mothers and their partners feel ready for the challenges and joys of childbirth. Chapter 5, Postpartum and Beyond, Caring for Yourself and Your Baby. The postpartum period is often overlooked in pregnancy books, but ACOG devotes significant attention to this critical time. The book's coverage of the first few weeks and months after birth is comprehensive, offering guidance on physical recovery, emotional well-being, and caring for the newborn. The first 6 weeks, healing and adjustment. ACOG's advice for the postpartum period focuses on both the physical and emotional aspects of recovery. The book discusses common postpartum issues, such as bleeding, breast engorgement, and hormonal changes, offering tips on how to manage these symptoms. There is also a strong emphasis on mental health, with advice on recognizing the signs of postpartum depression and seeking support if needed. The book also provides practical tips for newborn care, including feeding, sleeping, and establishing routines. ACOG's approach is supportive and non-judgmental, recognizing that every mother's experience is unique and that there is no one-size-fits-all approach to parenting. The first year, watching your baby grow. While the primary focus of your pregnancy and childbirth, month to month, is on the pregnancy and birth experience, the book also offers valuable insights into the first year of the baby's life. ACOG provides guidance on developmental milestones, feeding schedules, and when to call the doctor if you have concerns. This section of the book is particularly useful for first-time parents who may feel overwhelmed by the demands of caring for a newborn. ACOG's advice is practical and reassuring, helping parents feel confident in their ability to care for their baby and themselves. Conclusion: a trusted companion for every expectant mother. Your pregnancy and childbirth, month to month, is a comprehensive, well-organized, and deeply reassuring guide for expectant mothers. The American College of Obstetricians and Gynecologists has created a resource that is both informative and accessible, making it an essential tool for navigating the complexities of pregnancy. Throughout the book, ACOG strikes a perfect balance between providing detailed medical information and addressing the personal, emotional aspects of pregnancy. The month-by-month structure allows readers to follow along with their pregnancy, making the information timely and relevant. Whether you're a first-time mother or have experienced pregnancy before, this book offers valuable insights, practical advice, and the support you need to feel confident and prepared for the journey ahead. Your pregnancy and childbirth, month to month, is more than just a guide, it's a trusted companion that will be there with you every step of the way. Please read the book to learn more and consider subscribing to support the channel. Thank you.